To support India, government through the Ministry of Industry is going to send 3,500 oxygen cylinders to India, along with the help of some associations and private companies. And currently, there were 1,400 oxygen cylinders sent to India in the first phase. The Ministry of Industry is collaborating with associations and private companies to help India fulfill oxygen cylinders' demand for the treatment of COVID-19 patients. These contributions is expected to ease the impact of the COVID-19 pandemic that is currently hitting India. Indonesia sent aid in the form of oxygen cylinders to India, as many as 1,400 units in the first phase of a total of 3,500 to be sent. In this first stage, assistance came from the oxygen gas industry initiative, as well as petrochemical industry and the textile industry. Meanwhile, for the second stage, the funding is assistance from state budget.
Dan pemberian bantuan sebesar 1.400 tabung ini adalah hal yang luar biasa dengan nilai lebih dari 2 miliar dan 3.400 itu sekitar 500.000, dan ini tentu diharapkan bisa menjadi simbol kerjasama Indonesia dengan India, dan diharapkan ini adalah persahabatan antar dua negara yang sama-sama mitra strategis.
According to the minister, India has been one of the strategic partner countries for Indonesia, both in terms of diplomatic and economic cooperations, especially in the industrial and trade sectors. Therefore, it is such obligations to help India. From Jakarta, Adif Masha for IDX Channel. In a bid to accelerate and expand of the coverage of COVID-19 vaccinations in order to today, India recorded 4,529 COVID-19 deaths over the past 24 hours on Wednesday, and the highest daily toll of any country since the pandemic began, according to the figures from the India's health ministry. And of course, this was unpredictable since the second wave just began a month ago. Medical oxygen in India has been in severe shortage as the country grapples with the deadly second wave of the pandemic. And therefore, Indonesia helps to overcome this shortage by giving oxygen cylinders to India. And let's break it down in the next graphic. Through the next graphic, we can see oxygen cylinders from Indonesia to India. So currently for the first stage, Indonesia has sent 1,400 oxygen cylinders, and it is funded by Indian companies in Indonesia and also the associations. And meanwhile, for the second stage, Indonesia will give to another 2,100 oxygen cylinders and funded by the state government. And in total, there will be 3,500 oxygen cylinders will be given to Indonesia. And don't worry, because the ministry say that giving oxygen cylinders to India will not disrupt the supply of oxygen to the country, because it has been considered before that our oxygen supply is more than enough. And the medical oxygen is very vital for those who have been infected. And the dire shortage in India has turned out to be a major challenge facing hospitals in many states across the country. And dozens of hospitals in a number of Indian cities and towns have run short of the gas, sending relatives of patients scrambling for oxygen cylinders, and sometimes in vain. And therefore, it calls our humanity to help others. The coordinating minister, Erlangga Hartarto, explained that this assistance is an initiative of government along with the associations and private companies. So let's see the next graphic for the details. Here it is. We can see there are Indonesia Industrial Gases Associations, Carpet and Prayer Mat Industry Association, Samator, Indorama Synthetic, Asia Pacific Fibers, and Indo-Barat Rayon and Mutu Gadin Textile, and also Indorama Venture Indonesia as the coordinator for sending oxygen cylinders to Indonesia. And the first aid release was carried out by Samator Group Cikande in Banten on Monday this week, witnessed by Indian ambassador to Indonesia, to Indonesia, which is Manoj Kumar Bharti, and attended by the Minister of Industry Agus Gumiwang Kertasasmita. And not only received oxygen from Indonesia, many countries gave COVID-19 assistance to help cope with the record increase in virus cases that has placed a burden on the country's healthcare infrastructure. For example, the British Oxygen Company delivered around 1,350 oxygen cylinders to Indonesia. To India, what I'm trying to say is that. And India also received more than 50 oxygen concentrators from Thailand, and then more medical supply from European countries. The exponential surge in India's coronavirus infections over the past few weeks has swamped the healthcare system, seen patients dying in ambulances and parking lots outside hospitals and overwhelmed crematoriums. So let's see the latest data regarding COVID-19 in India in the next graphic. So here it is, the latest data regarding COVID-19 in India. We can see that the total cases in India is reaching 25 million cases, with a death over 200,000 deaths, and recovery only reached 21,000 that recovered. And due to India puts its citizen first, India is unlikely to resume the major export of COVID-19 vaccines until at least October. There a longer than expected delay set to worsen the supply shortage from the global COVAX initiative. And the Serum Institute of India, the world's biggest vaccine maker producing the AstraZeneca vaccines, responded that by saying that it hoped to restore deliveries to COVAX and other countries by the end of this year. Battling the world's biggest jump in coronavirus infections, India halted vaccine export a month ago after donating or selling more than 66 million doses. Now it has changed. There is a major plot twist as coronavirus cases in Indonesia and India is surging. There are some reasons on why cases is surging significantly in India. Therefore, I will elaborate it in the next graphic. Through the next graphic, we can see some reasons in here. First of all, is the protocol fatigue. According to the expert at the Johns Hopkins Medicine, human behavior is the major factor for the second wave of COVID-19 pandemic. And the strict lockdown that was imposed last year slowed down COVID-19 pandemic in India, giving the authorities time to ramp the requisite infrastructure, but it forced people to be cooped up in their home for so long. And better yet, India go out and there will be protocol fatigue. And the advertisement COVID-19 protocol too came along with the pandemic. Wearing face mask, washing hands regularly, and maintaining social physical distance was advised. But then it does not follow or penalized in some cases. And then urban mobility, India has recorded around 1.2 million cases of COVID-19, yet the pandemic is still mostly concentrated around the cities, especially the bigger cities, and these cities have greater mobility, giving more opportunities for the virus to spread from one person to another when the guard is lowered. And increasing testing is another reason on why India is detecting more cases in the second wave of COVID-19 pandemic. The Sera surveys have shown that India had a greater COVID-19 exposure than revealed through the confirmed cases of coronavirus infections and the basis of the laboratory case. And on the other hand, the incident in India should be a valuable lesson for the nations in Indonesia. Moreover, we just passed the Eid al-Fitr moment where the mobility of residents was very dense than usual. And yes, viewers, Indonesia gives COVID-19 assistance to help cope with the record increase in virus cases that has placed a burden in India's healthcare infrastructure. But this is not only hoping. And this is not only helping, this is spirit of solidarity and cooperation, a hallmark of India and Indonesia relations. Stay with us because market headlines will be right back after this quick break.